And going back to our story on the artificial intelligence mission, we are joined by Professor Kavya Dashora, who's Associate Professor at IIT Delhi, joining us. Professor Kavya, we're talking about the artificial intelligence mission. So what is the best way to, one of the goals is to build compute capacity. So, what is the best way to do that?
Good afternoon, Mark. It is a pleasure to be on the show, and it is really very pertinent topic that Indian government is pushing very hard about artificial intelligence, about its application, and particularly in a country like India, where we have a lot of welfare schemes being rolled out, and our medtech, our agritech, our infotech, our semiconductors, we are just trying to be the champions in the world. And for that, we require a lot of data, a lot of computing skills. So with government pumping in 10,000 crores of rupees and with the India AI Innovation Center in place, so it is going to just keep a cap over or a monetary watch over the research quality which is going on in AI, and also create more and more avenues. I am particularly very optimistic about agri-tech and medtech because when we are when we want to simulate something, and if we have good knowledge of AI, it not only reduces the time, but it also gives us the best solution, which out of several literature review and out of several practical experiments, it is very difficult to come to a solution in a very short time. So I am particularly very hopeful that in agri-technology and in medical technology, we are going to use AI like a game changer. And since we have a very clear plan of leading the world in these technologies, so I'm very sure this particular move of sanctioning such a big amount of 10,000 crores of rupees for making centers, dedicated centers for artificial intelligence research is a giant leap forward. It is a very optimistic move, and as a researcher who works on artificial intelligence and agri-tech, I feel that we were missing on this aspect. This was a bridge which is going to take us to the next side of the world, to the leaders panel now.
Sure. A lot of this is above the head of the common man, including well above my head. So, they're talking about LLMs. What I've Googled is that it stands for large language models.
Yes.
To cater to some singular industries. If you could demystify some of these terms for us.
Yeah. So just for the sake of audience and the aspirants who are in the queue, who really want to get on the board of artificial intelligence, I would just say that when too much of data is there in front of us most of the time, and as the president say, we mostly did not know what to do with data except applying a bit of statistics, making some prediction analysis out of it. But now what we do is we make combinations, we make trees. That means making the best fit which is possible. So just for the audience sake, I'll just give one example. Suppose I have to see a plant protein which is matching an animal protein. So my conventional options are, I do the chromatographic analysis of the animal protein, and then I evaluate all the plants which possibly may contain this type of a thing. But now with artificial intelligence, I just need to feed a computed program, and it is going to be large, so many plants, but very quickly, like with a blaze flash speed, it is just going to make a combination and just sift out the unwanted things. It is going to tell me the best possible combinations from which I can pick up my desirable molecule. If I have to predict a disease which is in the plant and which is at a very, very early stage, farmer itself cannot predict right now. If I keep on feeding the pictures for the pattern recognition or for the image processing computer vision part of AI, so as many pictures I feed, the computer gets trained on it. These are like large language models which we prepare, and then they keep on getting trained on it. And when time comes of disease in field and we just present a picture there, the computer is already prepared, very much like a student who has learned the language. So he would know, okay, this is the picture I have already seen. It belongs to, let us say, Tolyposporium penicillari, or rust of wheat, or smut. So instead of we undergoing a long disease detection process, the computer would just make a mix and match and give us a result very quickly. Pre-analysis of diabetes, which we call a borderline diabetes or pre-diabetes, is also very easy when you keep on feeding it with a lot of data, preliminary data, which general practitioners or health practitioners keep on collecting. And we keep on feeding it to prepare the models. Now, to be the leader in the world,
yes.
What our Prime Minister thinks and what the scientific cabinet thinks is that if we are able to generate these large language models in-house, that is indigenous. So indigenous models means we are fully utilizing our internet capacity, we are fully utilizing the data, and once we know that what we want out of data, stitching it backwards, we would also train our people how to collect data, what to collect in that data, because not everything would be a required data. Most of it would be noise.
Okay.
So developing a large language model or developing an AI tool like ChatGPT, very popular, very common, and it's like a buzzword nowadays.
Okay.
So if we have an indigenous ChatGPT, so it becomes very much like we know how to translate our data, and we are using it for our welfare schemes, for our identification.
So data is key, and it's also, I mean, the mission will be talking about a marketplace for data, and you've given us a proper analysis of how everything, even including skill sets, and I think the mission will be looking at all this. Thank you very much, Professor Kavya Dashora. Thank you for joining us, and happy Women's Day to you.
Oh, thank you so much. And it was a pleasure being with you. Thank you so much. Happy Women's Day.